Hello everyone, welcome to Dental Shots. I'm Dr. Mohanapriya Michael. Now we are going to see about how to excel in Viva. In this video, we are going to see what is the factor which is so important to score more marks in Viva, how far the Viva is different from other examinations, long before the Viva, what should we do, how to revise for the Viva voice, is there any appearance and etiquette so important on the exam date? And how should we answer the Viva? When you don't know the answer, how to switch over? Is there any trick to switch over to the other questions? What should you do at the end of the Viva? And overall conclusion. Let's move on to the video. If you have not subscribed to our channel, kindly subscribe to Dental Shots to watch much more videos like this. There are certain guidelines to survive in a Viva. Most of the students think that the understanding of the subject and the knowledge is more important, but it is not so. To score more marks in Viva, how you convey your answers and your knowledge to your examiners plays a very vital role while coming to surviving of Viva. How the Viva is different from other examinations. In other examinations, you will first answer the question which you know very well and lastly answer which you are not sure about. But in Viva examination, it needs a intelligent, structured answer. At the same time, in other examination, if you answer it wrong, you can cross it over and rewrite the correct answers. But in Viva, it cannot be done. It is not possible. Long before the Viva examination, you have to start planning early because you shouldn't rush up at the last moment. Revising for Viva is totally different. It needs a different style of preparation, wherein when you finish a topic, you have to close the book and keep it aside and think what is the definition, what is the classification, what is the cause, what is the differential diagnosis, what is the complication, what is the management. You have to set up your own question in this manner and prepare for Viva. For example, you finished a lesson of neoplasia, then you have to close the book and keep it aside and say what is the commonest neoplasm, how do you classify inflammation, what are the causes of neoplasm. These are the most important questions the examiner would likely to ask you in the examination. Always when you are preparing for Viva, there are other forms of preparation also. Always ask this question when you read any chapter from the book. Why should you know about this topic? Why should a dentist know about this? For example, the examiner can ask you, why should you know about myocardial infarction? Why you should know about the respiratory infection? So you have to have some justifying answer for him to answer it in a intelligent, structured manner so that the examiner will give you more marks. To get an idea and style of Viva questions, you can revise certain Viva revision books, but there is no replacement for your textbooks. You have to study from the textbooks, get your own brief notes, but only to get an idea and style of Viva question, you can revise the revision books like this. Like MCQ books and last minute revision books can be helpful to get an idea and style of Viva questions. As I already mentioned, when you are revising for Viva examination, like you have to take a brief note like definition, classification, causes, differential diagnosis, complication, management, you have to have some brief notes for each and every topic so that you can answer it well. So always make your own brief notes. Do not borrow from others. It will not be useful for you to excel in Viva. Here comes the exam date. There are a lot of factors which plays an important role to excel in Viva. Let's see each factor one by one. Let's move on to the main content. The appearance and etiquettes plays a very important role when facing on Viva. How you look and what you wear will definitely influence your psychologically as well as physically. There are certain etiquettes to be followed when you are addressing the Viva. On the exam day, as soon as you enter the room, Greet the examiners and sit as much as back as you can near the angle of the chair. Okay, do not sit in the edge of the chair, always sit as much as back as you can. And your posture should be without any cross legs, there should be no cross arms. Maybe you can put your cross ankles are okay, but cross legs are not allowed and cross arms are not very ideal to face an examination. So first greet, sit as much as back as you can, and your legs and arms should not be crossed. Maybe your ankles can be crossed. On the exam day, do not show anxiety. Most of the students express their anxiety feeling that the examiner may feel sympathize on him. But sympathy doesn't work in Viva. It reveals just that you are not so prepared for the examination. That is what the examiner will come to know when you show an anxiety. So do not show anxiety. There will be no sympathy towards you, but the examiner feels that you are not prepared for the examination well. So do not show anxiety. Always keep an eye contact with the examiner. For example, if there are 2 or 3 examiners sitting in front of you, engage your eye contact with all the examiners. If there is only one, maintain an eye contact. If there are 2 or 3, then you have to engage your eye contact with all the 3 examiners. Here comes the main content, how to answer the examiner in Viva. The examiner always need a clear and logical answer from you within minutes. Within minutes you have to give a clear and logical answer. In addition, why they are pressurizing you to put an answer within minutes? They are not able to give you more time because the examiners are in pressure of time. They have less amount of time to see all the students in that particular 4 or 5 hours. So they are in a pressure of time, so they need an answer in minutes. In addition, it should be clear and logical. If you don't hear the question properly, clarify with the examiner. I'm sorry sir, or I'm sorry ma'am, would you like me to tell about the etiology? Sorry ma'am, would you like me to tell about the management of neoplasm? So be clear with your question before even uttering an answer. Please open your ears and listen to the question very keenly. Even after hearing, if you are not sure what you hear, then you can clarify the question with the examiner. Sometimes the examiners are not prepared with formulated questions. So in that scenario, they put a big broad question in front of you. For example, they may say, tell me about neoplasm. It is a very broad question. Okay, you don't know where to start, whether you have to start from the etiology or management, you don't know. So at that moment, if the examiner says, tell me about neoplasm, never start answering at that moment. You are in a position to focus the examiner's mind. In that case, you have to ask, can I start with the etiology of neoplasm, sir? Can I start with the classification of neoplasm, sir? So you have to focus the examiner's mind by putting forth this question to them. So the examiner will be. On the other hand, if you start answering for that broad question, the examiner may say, this is not what I am looking for. So you will be under trap. So never start answering for a broad question without focusing the examiner's mind. At last you will be in the trap because the examiners may say that is not what I am looking for. So please focus the examiner's mind by putting forth some question like this, as I mentioned earlier, before answering a broad question. If you are not preparing well for your Viva, then you may face heart sync question. What is heart sync question? Simple. yet unanswerable at that instant. For example, if an examiner asks the difference between plasma and serum, that is a simple question. But in that anxious mode and that instant, you are unanswerable. So prepare well so that you shouldn't face any hot sink question. If you don't know a question, always practice saying I cannot recall. Do not say I don't know. At the same time, do not sit quietly and waste everyone's time. Practice saying I cannot recall. Most of the students say I don't know. So that is not so ideal sentence to use at that moment. You can practice saying I cannot recall. When the examiner asks you list some points on a particular topic, while listing never ever repeat the point which you have already mentioned. In addition, when you are finishing the list, kindly say the word the last one is. The last one is, because the examiner won't ask another one in the list. At the end of Viva, always say thank you to your examiners and stand up and leave the room immediately. Do not stand and look at them. Do not grimace, do not weep, do not look desperate. Okay. In addition, after coming out of the room, do not say to your friends, I should have done better. So, by saying this, you are inviting a response which will make you depressed even more. In addition, if you have another Viva, if you have a subsequent Viva, just put everything from your mind out and start over again. Hey, you think about the poor examiners who ask the questions to you, and many examiners find the Viva challenging. Some examiners frown at you. You feel that they are doubtful about your answers. But the reason for frowning is because where the questioning should go next is the one which is running in their mind. And what question should I ask? So, due to that, they may frown. Do not worry about their frowning. They are not doubtful about your answers. Think in that way and answer it very boldly in a clear, logical, intelligent, structured manner. As a concluding note, I will say tailor the exam style revision and practice your questions and answers. And also keep in mind, remember one thing, the examiners really want you to do well in the examination. I hope this video would have been helpful for you to excel in the upcoming Viva. All the best for your Viva examination. I am Dr. Mohanapriya, who is the voice behind Dental Shots. If you have enjoyed this video, and there are lots videos yet to come, if you want, kindly subscribe to Dental Shots and have a great day. God bless you all.